Dr. Raju Gautam did his veterinary training in Nepal, and he also has a master's degree in epidemiology and, wait, I'm going to go to my list because it's a long list of what he has done, in epidemiology and a PhD in epidemiology. He also has a lot of boots on the ground epi experience in Nepal doing surveillance and disease investigation for zoonotic diseases like rabies and AI, as well as livestock diseases. He has done work in postdoctoral work with human health data in hospitals, as well as in fish diseases in Atlantic Canada. So Raju joined the Canadian Food Inspection Agency's Aquatic Surveillance and Epidemiology section in 2016 and has been working on risk modeling for the diseases of finfish. And so I thought it was a great opportunity, given Raju's diverse background and ability in modeling and statistics and epi, to look at this as an example of some of the tools that are available to us. So thank you so much, Raju, for agreeing to do this, and we'll hand the presentation over to you.
Thank you, Andrea, for that nice introduction. And I felt really, really humbled and very fortunate to be, presenting this work today. And I basically like to thank Andrea for inviting me to present to this group who thought like it was, it was good enough to, share this work with the rest of the group. So the work that I'm going to present to you is basically the work that I had been doing since I joined the agency in October last year, trying to, use some kind of modeling to help design a risk-based surveillance for finfish diseases. And I'll give you a short example using Whirling Disease, and specifically maybe one more disease in addition to Whirling Disease. I'll share some information about that because that's an ongoing, ongoing work on that. So here is the outline for the presentation today. I will briefly cover, give you some start with definition for surveillance and its purpose, agencies' need for surveillance, and what is risk-based surveillance in general, and then follow that up with some of the challenges for risk-based surveillance in aquatic system, which will, basically give us a framework for the objectives that I'm going to present to you. And in order to achieve that objective, the methods that we used, and then finally give you some results which maybe you would hope you would find interesting, and then conclude my presentation. So surveillance basically is a systematic and ongoing collection and collation and analysis and interpretation of health data or welfare data, either humans or animals, for a defined population. And not only it doesn't end there, it's done with a purpose, with some interest to disseminate that information, and then with an intention to take actions like evaluate monitoring system, evaluate the control measures, or to design or plan some kind of mitigation measures. So generally, the surveillance could be done for many different purposes, but reasons. But all those reasons can be nicely summarized into 4 purposes or 4 categories: disease freedom, or to detect a disease, or to find a case of a disease, and to measure the level of disease, or what we call in general terms prevalence. The first two vertical categories are applicable or are more relevant when the disease is absent, and the second two vertical purposes would be more fitting when the disease is present in a region or in a country. And some of the challenges in aquatic system, before I give you what challenges we identified, I'd like to just make it a little bit more active here for the group, and then just put this as a question to you, and then ask you to develop a surveillance program for disease X to determine zones of presence or absence. And given this is the situation, and there has been first detection of disease X at this vertical location highlighted in a red dot. Would you have any? So this is purpose of putting this question up here to the group is to give you a little bit broader vertical experience in your own thought process to how you are going to approach this problem or approach this kind of request, and so that you have a bit more appreciation of what goes in, how do you select from the beginning, and also maybe the other reason could be did we identify the right vertical right kind of parameters or right kind of factors, and did we capture enough, or did we miss some? Do we get some additional vertical kind of insight from the group? Would you like to I'll just pause for a while, and then if you have something, anybody on out there listening in the audience would like to comment on that.
So I have lots of things, Raju, but my background is aquatic, and so maybe that's not fair. Does anybody else have any ideas they would put in there first?
Yeah, we can let some others speak, and then maybe yes, you could go in and then give your own insight if there is no one else.
And the principles are the same, terrestrial and aquatic, so what would you want to know?
Well, how would you approach this situation? When there is a detection, and then you'll have to develop a surveillance program for that disease and determine, in order to determine zones of presence or absence for the disease. How would you go ahead? So it's just, if everybody knows, if familiar with that, but I just wanted to let you know the whole process. It's not I might give you at the end, I'll share some results, and so that you have better appreciation of the amount of work that went in. That's why I just put this question up here.
This is Anna in Alberta. I just have an idea, and I hope this is what you're asking for, Raju. Let's say the red dot is confirmation of Salmonella enteritidis in a backyard flock.
Yeah.
Is that more or less what you were asking for?
Yeah. Yeah. So that could be one situation. So, and then now you have to develop a surveillance program in the whole of Canada. Then how would you proceed? Design a surveillance, an active surveillance program. If it's going to take lots of time, people are not commenting, then I can proceed. You can let me know at the at the end of the talk.
You're looking to identify the source. So a step backwards, is there somewhere that it could have come from to get there, and then a step forwards, where has it gone from there to somewhere else, and then you want your borders to be as broad as possible in case there's any trade impacts, because you don't want to be messing around with the borders and making them bigger and bigger.
Yeah, sounds good. Very nicely summarized. I think that's where you would start. So I'll just go back to the original slide, so wherever I left. So the challenges that we found with aquatic system was, as I showed you in the map, there are like over 200,000 water bodies that we have to deal with. And in order to collect and compile water connectivity and barrier information, which is important for transmission, they're looking at transmission or spread of disease in aquatic system, freshwater system, is very, very, very important. So that is, in a usable way or usable format, is quite challenging. Choosing an appropriate epidemiological unit for population now, like where do you want to start? How do you want to group the populations, separate the population? So that is another, what do you call, challenge that could be, that has to be addressed. So with that background, the objective essentially was to develop a method, because you can't do surveillance, you can't go sampling everywhere in Canada and because of resource limitations. So the objective is to develop a method for targeted surveillance in aquatic animal health. So how do we do that? So because you don't want to go looking for disease everywhere, just in a random manner. So the method we basically used was first step was to determine the epidemiological unit for the population. What population? How would you separate out the populations as your epidemiological unit? And then the other step was to identify potential pathways of introduction. What could be the potential pathways of introduction of this particular disease X into different sources? Basically, we identified these number of potential pathways. The first one, susceptible species present in the region or the epidemiological unit. It's not essentially a pathway. It's being revised. This document is being revised. You would have a document went out for review to other groups within CFIA, and they have really good suggestions, which we would put in the next version. So there would be changes. So it's just basically an evolving document and also a method. And the others, like hydrological connectivity, movement of live animals and eggs, could be considered as pathways of introduction. Introduction from mechanical vectors like commercial or recreational fishings and their gears, research use of fish for vegetation control purpose, and some kind of within waters at risk. I would come back to that. This again would be there has been a kind of really nice suggestion around this within waters at risk, which I wouldn't discuss right away, but I'll just present as we had, analyzed it for now, but there would be some changes later on. So following that, you had to come up with a way to assign pathway-specific risk scores. How would you assign risk scores? Basically, each of those pathways will have certain risks, and you have to come up with a way to assign risk scores to those pathways. And once you have done that, it's pretty much easy to compute total risk score by adding all those up. And then risk categorization is the final step, using some appropriate cutoff, and then that you can use for generating a risk map. So I'll take methods one at a time. First, let's talk about determining epidemiological units. So given I alluded to earlier that there are over 200,000 water bodies and they could be connected. So many of them are connected to each other. It's really difficult to, basically identify at a very small level the unit of an epidemiological unit of analysis. So we went around with secondary watersheds. So that is represented here with this dotted kind of delineations within each province. You can see those are the watersheds, and they've been labeled by numbers or the identifiers. Altogether, there are 169 watersheds in Canada, so that was our unit of analysis. And then we identified potential pathways of introduction. susceptible species, excuse me for that, putting up there. It would be something different later on, but like for now, it's a risk factor, but not a pathway of introduction. Susceptible species that we considered were 10 of them. They are more susceptible species to whirling disease. So I'm talking about whirling disease now because I have an example. I'm presenting an example about whirling disease, and that was the disease we started with for developing this kind of method. We consider 10 species because, although there are more than 10 species susceptible to this disease, because in Canada, these are the species that are known to be present and are susceptible to whirling disease. If they are not present, we didn't consider. So, and then finally, using that information, like we used the data for their distribution, and then you can see on this map how they are distributed. Some of those in green areas indicate that these species, none of these species are present in those locations, and the yellow ones are where susceptible species are present, at least one. Doesn't have to be all. And the next was to identify potential pathways of introduction. The second potential pathway was hydrological connectivity. So by hydrological connectivity, I mean within the unit of analysis, between the unit of analysis, that is between secondary water sets, if there is, a river or stream crossing across to the other secondary water set. That's basically the hydrological connectivity. And you may notice here on the map, there are like small black solid dots between water sets, which means that these water sets are hydrologically connected, and we are ignoring the direction of the flow of the water here. And also, just a single dot doesn't represent that there was only one connection. That's the only point of connection between the water sets. So using that information, we created a matrix. Which of these, 169 by 169 matrix, we indicate with an indicator like 0 and 1. 0 essentially meaning there is no connection between the two water sets, whereas 1 would indicate there is a connectivity. And just to reiterate that 1 point between the two water sets doesn't mean there is only one stream or river, crossing through. Just for an example, here, if you look at that, we zoom into that red square here, you can see these are all the points of connections between the two water sets, here, between these two water sets. And between these two water sets, these are all the points of connections. And at different locations, there could be different direction of flow. And this, again, the connectivity, we are updating it because when the connectivity matrix was developed, we didn't take into account the elevation. So now we are working with elevation data as well in order to determine whether there is, a sharp demarcation, and then the connectivity there is essentially not actually crossing of rivers, but, two streams, originating from similar that location, but flowing in two different directions. The next, what you call pathway of introduction we considered was human-mediated high-risk animal movements. And you can see on this map, all those, like, since whirling disease was first, detected in Alberta, so all these, what you call red solid dots, small dots that you see, those are the locations of trace outs from the positive farms or facilities, or positive, basically facilities. And you can see high risk transfers represented in triangles, white triangles, and high risk import locations are are diamond-shaped. There are 3 here on the map, and if facility, if there was a diagnosis or confirmed positive in a facility, but that was, that was contained facility that didn't have an effluent going out into natural waters, and if there was eradication measures put in place following the detection, that is indicated with the square. And positive vertical locations with stars, and suspect positives with, empty circles, like white circles. And I mentioned earlier about within watershed risk. For example, if there was a suspect for here, if you notice, if there was a suspect positive diagnostic finding, but it was not confirmed for many different reasons, diagnostic sensitivity, or poor test, or poor protocol, or something, for any reason, any different kinds of reason, then we would give some kind of a risk score at that level. But this is going to change a little bit because following the suggestion from risk assessment group, who have given us like kind of good, very good vertical feedback. This is going to change slightly, but for now, that's how we had analyzed it before. So once we have done that, then main thing was to assign pathway-specific risk scores. And that was done through discussion within our group and in consultation with provinces. And also, I just wanted to, mention it here. All these data, like movement data, and then recreational fishing or commercial, all those risks things. A lot of consultations went along with the provincial partners in order to get that data and also to get their feedback into assigning specific risk scores for each of those pathways. So I just want to give you that vertical just to give you an appreciation of amount of work that went in. And because if all the data is available, you can do the analysis pretty quickly. It doesn't take so much time. And then compute total risk score once you have done that. And then risk categorization was basically what we did, what we consented to. The cutoffs were as follows here. So we said there was no risk if the risk score was 0, and minimum risk if it was between 0 and less than 2, but not equal to 2, low, moderate, high, and very high risk if it was greater than 4. And then using this cutoff, we created the risk map. And that's the risk map that was first, created. And you can see most of so these, what you call hats, or dark red areas were established, or these watersheds were, these 2 watersheds were positive at that point in time, and these are the 2 very high risk watersheds, and then around them you can notice moderate to high risk watersheds. But what I want you to, so basically how was a little bit more detail about how this map was created. These are all the pathways of introductions that we considered as I described it earlier, and then say for 2 watersheds 0 to G and 0 to H, we have all that information. We assign scores, and then we have a total risk score for these 2. We'll have same thing for all of the watersheds, and then how it was calculated was sum up from all of these and then multiply with A. That is important because if the susceptible species is absent, then you don't want to have a risk score, as high as like anything between highest to low. So this is just an indicator of presence or absence, 0 or 1. So when you multiply that, it basically takes care of that problem, like whether the susceptible species was present or not. So that was the purpose. And notice there that's the that's the high-risk areas or the positive area, and also notice that this was generated in, so that's why I mentioned earlier, like it's an evolving vertical work. So that was generated in April 2017. I'd like you to, I'll take you to a more recent version. Here you are. So you see now we have the third vertical watershed also declared positive now. And you can notice this was generated in June 2017. And so it could change over time. Once we have that, like if we want to target the high risk, second step is to basically target the high risk watersheds. But even within watersheds, there are lots of water bodies and they're all connected in different ways. Some are isolated. So the purpose was to perform second stage analysis. And in the second stage analysis, we would just focus to the high risk watersheds. So here, this was the high-risk watershed here at that point in time, but this is now declared what you call positive. And then we can see all these, the arrows, all the rivers, major river systems, and the arrows indicate the flow direction of the water. And then we overlaid that with trace out information like in red solid dots. Hydrological connectivity you can see between the positive watershed here and over here. So all that information in there. So that's from this Alberta area. So it's just zoomed into that. So I'll just zoom in more, and we can see that there were samples also collected from these locations. So this is like more details here. You have green stars. That's where the samples were collected. And I think most of these samples or some of these samples tested from these locations tested positive and were confirmed, and then that led to declaring this watershed as positive. And we can see that there were no samples basically collected from this area or this area. If we notice, there were like more trace outs in this location. So it depends what is more, which risk factor is more important at spreading the disease. Given it's spreading from the positive, watershed, not coming in from it wasn't present there from, before, say from before here. But that's just an assumption. So when we zoom in more, you can see, and then I put in more layers of the dam locations where that could, basically say the flow of water maybe controlled here, or movement of animals would be controlled here. So that information can be overlaid, and then we can decide to, basically use this information to go to where to go and sample. I'll give you another example another disease for which we basically used the same methodology to come up with the risk map for our surveillance purpose, and that's the spraying viremia of carp. And this is the map that was generated, and you can see the legend here, the positive location here. We didn't assign entire watershed as positive in this case because that was not officially declared by the CFIA yet, and only the lake that was positive for disease like long time ago, it has not been detected anywhere else, reported from anywhere else. So basically, put the rest of the watershed as high risk, and only the location of the lake where it was found positive as positive. And you can see we have additional what you call legend here, highly connected to high risk. So after completing the risk analysis, like doing the risk map, we figure out that this particular watershed here, these two watersheds are highly connected because there is a major river system that feeds into Lake Manitoba. So if there is not enough opportunity for sampling out here, it's possible that we could utilize this information to go and sample here, and then say basically the two populations maybe have a similar risk, or at least have much greater risk than any other area, like given this has a high risk and there is a high level of connectivity. So given all that, I'd just like to bring up some kind of limitations and the challenge to repeat challenges again. So we had quite a lot of assumptions here. We ignored the direction of water, as I mentioned earlier, and barriers in the first step of analysis, and then species susceptibility could be, variable, although we had like 10 different species susceptible, but not all species are equally susceptible. The assumption was they are all equally susceptible for our purpose here. We didn't know the distribution of TB-fax worm, that is the intermediate host for spreading disease, and we had to assume that they are uniformly distributed. And we also ignored illegal movement, animal movement, because we didn't have any data. So we'd assume illegal movement would, happen uniformly across all watersheds if they were there. Some of the data issues like missing labels, GIS data, missing labels, incorrect names, so we had to deal with all that. And we took into considered only species distribution, present or absent, which I think is quite good enough, like versus the proportion we could use if we had the data, but that's quite challenging, like to have distribution of species by and relative and their relative abundance compared to other species. So limited our import trace out back to 5 years. There could be arguments from people may argue and say, oh, well, what if the disease had been introduced a long time ago, and because we didn't trace that, trace back enough. And could be, maybe if the data is available, if that's an argument, we could, put that information and see. Illegal movement, essentially, I mentioned earlier, and then subjective judgment of commercial or, so it's not very objective, but we try to have consultations with provinces and then get their, best, what you call, judgment around that. And relative importance of risk factors is unknown. We don't know which of the risk factors we considered are relatively more important than others. So moving forward, we would like to continue working on water body connectivity, refine it more, determine the level of details that is required, that we want to have, and that can be achieved, and identify ways to improve data gaps. And potential areas, we just suggest from here, potential area of research would be to, figure out the relative importance of risk factors. What risk factors are more important in the introduction or spread of disease than others? And develop a framework for other situations, like, take this as an example, and because this may not apply to all the situations we are faced with. So for example, semi-open marine system where, fish or the aquaculture is being, done in a net pen kind of environment, and wild marine system, if you want to go out and, do surveillance in the wild system in the marine environment. So we'll have to use this as an example and try to, modify or come up with ways to develop framework towards doing a risk modeling for those kinds of situations, and basically adapt the method for some of the diseases like SAV. Not all, we might have to combine more than one framework, and so just an example of SAV, it's in the farm environment, so in the marine system. So we might have to combine some aspects of freshwater, some aspects of marine, what you call semi-open framework model, and then make a hybrid kind of method, use a hybrid kind of method to do risk mapping for these kinds of diseases. So with that, I would just like to conclude my presentation with this statement here. Basically, I feel, or we feel like GIS-based multi-criteria analysis is a useful tool for designing disease surveillance in aquatic system. However, the assumptions I mentioned and the limitations of the method should be well understood, and the risk categorization using this method should not be considered a probability measure, which is often, done on or understood by risk assessment, people who are engaged in risk assessments. So, and then there could be questions of whether this particular model is right. I would like to that kind of question, my answer would be no, all models are wrong, but do we do a better, does it serve us better? Does it serve us better to, do our job than just basically going randomly and then trying to do samplings all over the place and, basically wasting, and not having enough resources to do that. And finally, I'd like to, thank everyone who participated in this project, specifically all the members in aquatic surveillance and epidemiology section, including my manager Natalie Bruno, and other members Annie Wagner, Pascal Meret, Melanie Seffert, who took part in several consultations, and then all the provincial partners and stakeholders, and the federal government, other federal governments like DFO, listed out here on this slide. So with that, I just want to end my talk and open myself to any questions if the group has. Thank you.